Dementia is a general term for decline in mental ability and affects millions of people worldwide. Former Teen Idol and Partridge Family star David Cassidy revealed his diagnosis of the disease this week. The 66-year-old says dementia runs in his family, affecting both his grandfather and his mother. Dr. Richard Golden with Neurological Clinic at Abbott Northwestern joins us tonight. Thanks for coming in, Doctor.
My pleasure.
We do appreciate it. And this has a lot of people talking this week. Dementia always does, of course. And I guess that is really the big question, I'm sure, which you get a lot. But is this, in fact, hereditary?
There is a hereditary component to some of the dementias. There's less of it is hereditary than you'd imagine. There are hereditary risk factors and there are determinant risk factors, and that's where the heredity comes in.
And if we, do have a family history, is there help out there if this is something we're going to get eventually anyway?
Well, not everybody gets it, and that's the lovely part of it. At age 85, 50% of the population is affected. But that's changing as we start to use a lifestyle that's a little bit more healthy. I think it's nice to be able to know that this is a possibility for you, but most people don't really have to worry about it directly. If they follow a lifestyle that's more healthy. And
that's what we heard David Cassidy did say. He kind of delayed this diagnosis because of fear, and I'm sure you hear those stories again and again. But what is your message to people that may think similarly?
Well, if there are significant warning signs that people are picking up, such as memory issues, and that's just one part of dementia. I mean, memory is the part that most people think of, but there's behavior parts, there's language skill parts, there's difficulty remembering where you put stuff, there's mood changes, and all those things are a part of the diagnosis of dementia.
And those warning signs that you just kind of mentioned, are those things we should be looking at happening over and over again in our loved ones? We shouldn't possibly freak out if we just see it a couple times.
Well, all of us forget why we went into a room, what we were going to do, and we all forget words from time to time. It's the frequency with which you do it, and it's the context in which it's in that makes the difference.
We do want to end this interview with some kind of hope. Are we making any strides when it comes to treating this?
Yeah. In year 2000, we really had excitement because we had 2 drugs that came out. Unfortunately, there hasn't been anything else since that have been particularly good. However, right now we're making tremendous strides in biomarkers. And biomarkers then, making an earlier diagnosis, give us the opportunity to try some of the drugs that didn't work before and see if they'll work at an early age when there isn't any obvious signs of dementia.
And I know you mentioned Minnesota researchers and doctors here are really making a lot of headway when it comes to this.
Yeah, there's some real hot people in town.
Okay, which is good. That makes us feel better. Doctor, thanks so much for coming in tonight.
No
Dr. Golden, and there are several locations for the Neuran clinics all across the metro.
Right, exactly.
Okay, thank you, Doctor. And if you would like to learn more about dementia and help with the cause, we do have a link at WCCO.com.